Vitamin B12 deficiency symptoms and vitamin B12 benefits. Vitamin B12 is an important water-soluble vitamin. It is also known as cobalamin. It is needed to produce red blood cells, which are very important. Vitamin B12 is also needed to produce DNA. It is also needed for the replication of cells. It is also needed for the proper functioning of the nervous system. Vitamin B12 deficiency causes anemia. Animal foods are the major source of vitamin B12. Foods like meats, fish, poultry, eggs and dairy are rich in vitamin B12. Vitamin B12 deficiency is pretty common, especially in the elderly people. Vitamin B12 deficiency occurs when there is no sufficient intake of vitamin B12 rich foods, or you cannot absorb it due to some medical condition. So, who is at risk of vitamin B12 deficiency? Number 1, the elderly people. Number 2, people with part of their intestine removed through surgery. Number 3, people on the drug metformin for diabetes. Number 4, strict vegetarians. Number 5, long-term use of antacid drugs for heartburn. So what are symptoms of vitamin B12 deficiency? It is unfortunate that symptoms of vitamin B12 deficiency can take years to show up, and diagnosing it can be complex. A vitamin B12 deficiency can sometimes be mistaken for a folate deficiency, because low levels of B12 also cause your folate levels to drop. However, if you have a B12 deficiency, correcting low folate levels may simply mask the deficiency and fail to fix the underlying problem. Here are vitamin B12 deficiency symptoms. Number 1, jaundiced or pale skin. Jaundice is a most common symptom. It happens due to lack of red blood cells. People often look pale or have a slight yellow tint to the skin and whites of the eyes, a condition known as jaundice. This occurs due to vitamin B12 deficiency, which causes the bone marrow to produce large, fragile and faulty red blood cells. This condition is called megaloblastic anemia. This type of anemia causes the skin to turn pale. Then these fragile cells are immediately broken down by the liver and a red-brown substance known as bilirubin is produced. Large amounts of bilirubin are what give your skin and eyes a yellow color. And the second symptom is weakness and fatigue. Due to low levels of red blood cells, there is not enough oxygen for the cells to work properly. This makes you weak and tired. In the elderly people, this type of anemia is often caused by an autoimmune condition known as pernicious anemia. People with pernicious anemia don't produce enough on an important protein called intrinsic factor. Intrinsic factor is essential for preventing a vitamin B12 deficiency, as it binds with vitamin B12 in your gut so that you are able to absorb it. The third symptom is peripheral neuropathy or sensations of pins and needles. One of the serious side effects of a long-term B12 deficiency is neuropathy caused by the nerve damage. Numbness or tingling sensation in the feet or hands is a common symptom. You may feel pins and needles. This can occur over time as vitamin B12 is important to produce a fatty substance myelin. Myelin surrounds your nerves as a form of protection and insulation. Without B12, myelin is produced differently and your nervous system is not able to function properly. One common sign of this happening is paresthesia or the sensation of pins and needles, which is similar to a prickling sensation in your hands and feet. Interestingly, the neurological symptoms associated with B12 deficiency usually occur alongside anemia. However, one study found that about 28% of people had neurological symptoms of B12 deficiency without any signs of anemia. That said, sensations of pins and needles are a common symptom that can have many causes, so this symptom alone is not usually a sign of B12 deficiency. And the fourth symptom is changes to mobility. If left untreated, the damage to your nervous system caused by a B12 deficiency could cause changes to the way you walk and move. It may even affect your balance and coordination, making you more prone to falling. This symptom is often seen in undiagnosed B12 deficiency in the elderly people, as people over the age of 60 are more prone to a B12 deficiency. However, preventing or treating deficiencies in this age group may improve mobility. Also, this symptom may be present in young people who have a severe untreated deficiency. And the fifth symptom is glossitis, mouth ulcers, or bleeding gums. Glossitis is a term used to describe an inflamed tongue. If you have glossitis, your tongue changes color and shape, making it painful, red, and swollen. The inflammation can also make your tongue look smooth, as all the tiny bumps on your tongue that contain your taste buds stretch out and disappear. As well as being painful, glossitis can change the way you eat and speak. Studies have shown that a swollen and inflamed tongue that has long straight lesions on it could be an early sign of vitamin B12 deficiency. Additionally, some people with a B12 deficiency may experience other oral symptoms such as mouth ulcers, feeling of pins and needles in the tongue, or a burning and itching sensation in the mouth. Bleeding gums is often a problem with diabetics taking metformin drug. And the sixth symptom is breathlessness and dizziness. If you become anemic due to a B12 deficiency, you may feel short of breath and a bit dizzy, especially when you exert yourself. This is because your body lacks the red blood cells it needs to get enough oxygen to your body cells. However, these symptoms can have many causes, so if you notice that you are unusually breathless, you should speak to your doctor to investigate the cause. And the seventh symptom is optic neuropathy or disturbed vision. One symptom of vitamin B12 deficiency is blurred or disturbed vision. This can occur when B12 deficiency causes the damage to the optic nerve that leads to your eyes. The damage can disrupt the nervous signals that travels from your eyes to your brain, impairing your vision. This condition is known as optic neuropathy. Although alarming, it is often reversible by supplementing with B12. And the eighth symptom is mood changes and dementia. People with B12 deficiency often report changes in mood. In fact, low levels of B12 have been linked to mood and brain disorders like depression and dementia. The homocysteine hypothesis of depression has been suggested as a potential explanation for this link. This theory suggests that high levels of homocysteines caused by low levels of B12 could cause damage to the brain tissues and interfere with signals to and from your brain, leading to mood changes. Some studies suggest that in certain people who are deficient in B12, supplementing with the vitamin can reverse symptoms. It is important to note that changes to mood and conditions like dementia and depression can have a variety of causes. Thus, the effects of supplementing in these conditions remain unclear. If you have a deficiency, taking a supplement may help improve your mood. However, it is not a substitute for other proven medical therapies in the treatment of depression or dementia. And the ninth symptom is high temperature. A very rare but occasional symptom of B12 deficiency is high temperature. It is not clear why this occurs, but some doctors have reported cases of fever that has normalized after treatment with low levels of vitamin B12. However, it is important to remember that high temperatures are more commonly caused by illness, not a B12 deficiency. Vitamin B12 deficiency is common and can present itself in various ways, making it difficult to identify. If you are at risk and have any of the symptoms mentioned above, speak to your doctor. For most people, a B12 deficiency should be easy to prevent simply by ensuring you are getting enough B12 in your diet. This is it, guys. Please give this video thumbs up and share this video with your friends. And subscribe to my channel for upcoming videos. Thanks.